All right, so at this point, so we're just gonna remove the edge that's under that yucky tissue there.
Okay.
And you will feel me moving your foot and your toe, but you won't feel anything that hurts. Do you want me to lay you back or do you wanna watch? Or?
I'll watch it.
Okay. It's just a little disinfectant here. Okay, so what we're looking at is this nail goes down under there, and then it's created this little piece of tissue here that we call granulation tissue, which has lots of teeny little blood vessels in it, and it comes when you're just irritating the skin underneath there. So the first thing we're gonna do is just loosen up the skin around this edge. Now, you normally get pedicures, and so have you had a procedure done on this previously? No. So you just cut it really far back, it looks like.
Yeah.
Your pedicurist does that?
Oh, no, I did that this time.
Okay. So I'm just gonna go in and free it up underneath. Anything that hurts?
A little bit, but not too bad.
Okay. If it hurts, I can stop.
Is that bad how I cut it like that?
No.
Okay.
If you can see what you're doing and you can reach it, then there's no problem doing the cutting on your own. Is it the pressure you're feeling, or?
Just a little bit of pain. But
Okay. All right, this will be the last thing that hurts. I'm just gonna take that edge out and look at what was under there. Look how big that piece was
Jesus.
that was sitting under there. Okay, so now that the piece of nail is trimmed all the way back, the irritation will be gone from that tissue, and it'll just dry up and go away.
Okay.
All right, are you feeling a little faint? I'm gonna tip you back here. Yeah, that's why most people don't wanna watch these. Okay, so I'm just gonna put a little antibiotic dressing on it.
Okay.
Now, when the anesthetic wears off, this will feel better than it did when you walked in. All right, so it's all done. Stay with me. All right, so that's it. We are done. Thank you for letting me film that.
Huh?
Thank you for letting me film it.
Yeah.
Just gonna have you just wait here for a couple.